to the Workforce Crisis Task Force. We'll start with a roll call here in a minute, but I want to remind us all that to the extent possible, please turn your camera on for better engagement. And as I said to a couple folks, I've been having some weird camera problems, so if all of a sudden I go dark, my apologies. Remember to use our mute buttons as needed. Feel free to put comments or links or anything in the chat box to share. All of our speakers always appreciate some visual cues while they're talking to help understand if they're connecting with folks. Feel free to raise your hand, give the old thumbs up, whatever makes sense to you. If you need closed captioning, a reminder that if you go to the toolbar and click on the 3 buttons, you can turn on live captions. All of our documents will be posted on the DODD website. And since we are a public meeting, we welcome guests to observe, but guests do not actively participate in our meetings. So our agenda for today is to go through some of our pending action items with some updates that you see listed there, and a presentation on a recent DSP survey conducted by Nysonger, and then talk a little bit about our go forward process. So I'd like to start with a roll call vote. It's in alphabetical order if that helps you get ready to unmute. So Jason Abadili.
I'm here.
Dick Gable.
Good afternoon, everyone.
Kimberly Howe.
Hi, everyone.
Kristen Henry.
Good afternoon.
Deborah Hoffine.
Hi, everyone.
Debbie Jenkins.
Good afternoon, everyone.
Willie Jones.
Good afternoon.
Kim Kelly. Okay, we'll see if she comes on late. Teresa Cobelt told me she didn't think she would make it today. So Teresa, are you on? I didn't think so. Okay, Pete Moore. He's not here today? Okay. Scott, here for him? Okay. Rivo Murnix. Whoops, Scott, if you're talking to us, you were muted. Still can't hear you.
I'm trying to unmute him.
Okay, thank you. All right, well, welcome, Scott. We're glad you're here. Rivo Murnix. Janet Stefan.
Hello.
Bethany Toledo. There she is.
Yep, good afternoon.
Gary Tonks.
I'm here.
Nate Turner.
Present.
Jason Umstadt.
Present.
Renee Wood.
Here.
Hi. Okay, welcome everyone. We're glad you're here. We're going to start off with our director comments and then start working through our updates.
Hi, everyone. Thanks for joining us this afternoon. We were talking before everyone jumped on. I know it's a busy time for everyone. It's conference time, and I know that the workforce crisis continues to be an issue for everyone, and folks are really busy. One of the first agenda items I know is for Lori, but I'm going to go ahead and touch on that during my opening remarks. So I just want to take a few minutes to just touch base and say, I know that we've talked a lot in this group about different ways to use the competency-based add-ons as well as other funding mechanisms. And I wanted to thank all of the associations for coming together and submitting a single agreed upon proposal for me to present to the administration. That was really, really helpful. And of course, thank the county boards for coming together to provide the match, the funding to make that proposal viable to provide the supplemental payments. So I've been able to take that forward to the administration and to Medicaid. I want you to know that Director Corcoran is totally on board with the proposal. So I'm excited to work with her. And, we have some things to work through still, but hopefully we'll be able to report back on that soon. I'm really optimistic about the proposal. So I just wanted to give this group that update. I also want to thank the providers that are participating in filling out all these spreadsheets and working with Clay to figure out the simplest, easiest way to report, to get a good reporting mechanism. So I know that's taking a lot of your time and effort, and we really appreciate that. So thank you for all of the work that you're doing. Clearly all of us together can make this work. So I know Lori is muted. So I don't know, Kathy, if you can unmute her or if you even have anything else that you want to add. But that's, I don't have much more than that to say about the proposal, but I did want to give you that little bit of an update. So wait, let me see if I can.
I think I did.
Oh, there you go. Good.
Yay.
I got you moved.
I just wanted to add a couple things real quickly, but first of all, I wanted to thank the department from not only Director Houck, but Clay and Debbie Hoffine, who have literally put in, a zillion hours on this. I mean, Kim has carried the water to the administration. Clay has done so much legwork on the verification tool with a small group of folks that met a couple weeks ago. And as already said, is testing it with providers. And I know that Debbie's been working with ODM on a mechanism to move this forward very quickly. So we're very appreciative about all of that. I mean, as was already stated, we do have a few things to work out, but I really think we're very close. The last couple of days, I think we've gotten to a good place of, I think we're finally pretty well where we think we need to be. So very excited to move forward with this. Think it'll make a big difference, and feeling very optimistic, as Director Houck said, about the next several weeks in terms of getting this to move pretty quickly. So thanks to everyone.
All right. Thanks, Jackie.
Okay, thank you for that. So we can go down then to our next update. Deborah Hoffine is going to share with us where we're at with the rate consultant RFP process.
Good afternoon, everyone. We have, the process is moving a little slower than we had originally anticipated. We learned recently that due to the length of time we anticipate that it will take to complete the contract to modernize the waiver reimbursement system, which we projected to be ready to go and in place for July 1st of, I got to get my years right, 2024. That would take this contract across the end of a biennial budget for the state. And as an agency, we don't have the authority to enter into a contract that crosses over the biennial year cutoff, the 2-year budget cycle. But the Department of Administrative Services does. And so state agencies who need to have a contract, such as what we're doing, have to allow the Department of Administrative Services, or DAS, to actually post the RFP and sort of accompany us through the process. I'm sorry, I'm echoing. And so we have been working with them. We have our fiscal team involved. So they have a bit of a different structure for their RFPs than what we use. And so they took what we had, They had some questions for us and some additional forms we had to complete and some additional work to be done. I believe we finished all of that up yesterday afternoon and so it'll be back into DAS's hands probably today or tomorrow, I'm guessing, when our fiscal folks make sure all the I's are dotted and T's are crossed. And once DAS gets it back, they'll be able to give us sort of their time frame on when they can expect for it to be posted. Of course, we'd like to leave it posted probably for the better part of 6 to 8 weeks to give organizations time to prepare their bids, and submit them. So right now we're kind of in a waiting game, but I will say that DAS has been very responsive. They do understand how anxious we are to get this RFP posted. So they've been very responsive in helping us get sort of our format into theirs. And so we do appreciate, their assistance, and they do understand the significance of the contract. So we are still hoping to have the RFP posted within maybe by the end of June. We're hoping. We haven't, again, DAS just hasn't given us a timeline yet. Once they have our completed packet back with all of their forms, they will let us know. So I'll have a little more detail on that. And we are still, of course, shooting for the 7/1/2024 implementation either way. The only thing the delay in the posting would do is just make us a few weeks behind starting. So it's still well underway, and we are very, very close, we think, to having that ready to hit the streets. We just have to see what DAS's schedule looks like, and then I'll provide an update on that. Okay.
Gary has his hand up. Gary?
Could you give us an update on the financial management services? What, if anything is happening on that?
I think I can.
Okay.
We have selected a new financial management services provider to start July 1st, which means we're working with them now. We've had our first 2 meetings with them. It is not our current FMS vendor. And so there will be a good bit of transition work that needs to happen throughout the month of June to get, self-participant directed HPC providers who are being paid by our current FMS to get them onboarded with the new FMS. And of course, service plans will need updated. There'll be quite a bit of work going on for the month of June. Our vendor is very excited to get that started. Very excited to meet all the folks here in Ohio. I'm just not saying their name today because in order for them to actually do anything, for us to communicate any, of course, HIPAA information, which almost all of this is, with them, we have to have a business associates agreement signed. And since our contract with them doesn't officially start until 7/1, we are entering into a non-compensated contract to get us from now until July 1st so that they can do all the onboarding, they can do all of everything that needs to happen. And they have that contract in their hands. Their legal team is reviewing it to get it signed. I imagine we will have it back in a couple days. We'll get it signed, and then it will be a real thing. So it's a real thing now, but I think our legal folks want us to be cautious. And I think that's about as much as I can say right now, unless you have some general questions. I think Willie has a question. No? Maybe? No? Okay.
See if I see anyone in the chat room. Nope. Okay. Thank you, Deborah. Appreciate it. There's a lot of hard work behind those couple of minutes of explanation. So thank you very much. Steve Beha is going to give us an update on the direct support professional RFPs that we discussed last time.
Thanks, Jackie. So we do have both RFPs posted. I'm actually going to put them in the chat right now so everybody has the links. We've had them in Memo Monday. We'll be sure that they're in publications moving forward, so so folks know where they are and where they can access them at. The first one, just a quick recap of what they are. The first one that I have in the chat is a general best practices or creative ideas around how to support DSPs in lots of different ways. Everything from recruiting and retention practices through supporting them on the job, supporting them with technology. And so any creative ideas around that could be scaled is kind of what we're looking for in the first one. And then the second one is mainly around training practices around could be recruiting and retention, HR practices, things like that. Again, really focusing on some new and creative ways to really help out the system providers, DSPs throughout Ohio. So those are the two. They're posted. Each one has one's on Ohio Buys, one's on our website. So please follow the instructions carefully. They're just a little bit different because of the platforms that they're on. But essentially the inquiry period is open. And so, us at DODD who are involved with the RFP can't really answer any questions, specific questions about the deliverables, the RFPs themselves. All that has to go through that formal process. So again, just making everybody aware of that, but please, if you have specific questions about it, go through the formal RFP inquiry process, and we'll be sure to answer the questions through that. Jackie, I think that's all I have, unless anybody has any very general questions about the RFPs.
I don't see any hands up. Okay. All right. Thank you for that very much. The next update we were going to receive today is from Jeremiah Wagner, and he was going to share with us the status of the public service announcements and Ohio Means Job campaign that he's been working on cross agency.
Thank you, Jackie. Hey, everyone. Yeah, just a quick update. I know we've been talking about this at most of the meetings, but we've made some really good progress with the public service announcement campaign. The vendor is actually out shooting the commercial today and tomorrow. And so our very own Nate Turner from the work group that everyone knows very well will be our actor extraordinaire. He is going to be in the shoot with an outside actor playing a DSP. So they'll be filming tomorrow, which is really exciting. So that commercial, the shoot will be wrapped up this week. The vendor is going to, work again with ODH and the rest of us to get that finalized with a goal of seeing some of the ads hit the airwaves in June. So the idea is in June to see some commercials, some billboards, social media campaigns, and some other print materials, radio as well. And so that's the update. We're moving along and getting things out the door. So really excited about it. And a special thanks to Nate for agreeing. We're excited for tomorrow. If anybody has any questions, happy to answer.
Willie has
Jeremiah, sorry about that. I just have logistical questions. If you could maybe call or email me at some point. Okay.
Yep,
thanks.
we can touch base after, Nate.
Well, Nate, next time we see you, you could be an Emmy award-winning actor. Could be a whole new thing for your resume.
I'm not so sure about that, but anything I can do to help this moving forward, I think is time well spent.
Willie, I see that you have your hand up.
Yeah, so how long will the campaign run? And is that going to be statewide?
Yeah, good question, Willie. So we spoke to sort of the ad buy vendor this morning and talked about certain demographics and parts of the state. And I think what we spoke to is, for our industry, at least, this being certainly a statewide issue, that there wouldn't be any particular pockets that we needed to exclude, but that we were really feeling this everywhere. And then just a little bit about the demographic, of a DSP, the education level, salary types. So they got that feedback, and we're getting feedback from other agencies. I believe the initial ad buy, and this might be the only, so they'll run in early June is the plan. I don't know if there will be any, if there's any flexibility in there if things get delayed, but the idea is early June. And the state has allocated $1 million for the ad buy. I don't have a timeline if that'll be like a month blitz at this point or if it'll extend throughout the summer. But that's the general plan, is $1 million kind of behind the buy.
Will there be coordination with local TV networks to continue to promote that or to introduce the campaign? And then will county boards and providers have access to those campaign materials after it runs?
Yeah, so I believe that we'll have access to all those materials. We'll have, we'll certainly share them. We'll certainly be promoting them ourselves. And so I think that is part of the plan, that we'll be able to share that with you guys as well.
Christina or Christine Brown, she's presenting later today. Did you have a quick question?
Yes, more like a comment that Jeremiah, it'd be nice to have the detail once it's been done so that we could try to put that in our DSP workforce crisis project report and saying what kind of strategies are states and counties doing. That's something that would be useful to add into our policy brief, just to say.
That's such a gray area.
Yeah, thanks, Christine. Yeah, happy to share that with you.
Okay. All right. Anything else? Jeremiah, we're happy to see that kicking off. Is there anything around, I know at one point you told us that for it to be the most successful, we may have to make sure everything we have is up to date in the Ohio Means Jobs portal. Is there any information about that we need to be sharing or working on?
Yeah, that's one of the outstanding questions that we don't have an answer to yet. If there will be, a job aid or any materials that we can share. I think everybody knows that we've been trying to drive people to that website, and I think that's the intention. And so, but yeah, we've posed that question and hope to be able to share some stuff before the ads get running, so people can make sure that they're driving traffic to the right place.
Okay. Thank you. All right, so we have two guest presenters today from the Nysonger Center. We want to welcome Christine Brown and Lauren Hackenberg, and they're going to share with us some results from a recent DSP survey that they have been conducting. So let me turn it over to you. Hopefully you can share screen. If not, let me know and we'll get your PowerPoint pulled up. Looks like Lauren is still a guest. So Kathy, I don't know if you saw that in the chat, if you can switch her.
I did switch her.
Hi, everyone. Thanks. Let me just share the screen.
There we go. Thanks, Kathy.
Okay. Are you guys seeing my screen right now?
Yes.
Okay, great. So hello, everyone. My name is Lauren Hackenberg, and I am the program coordinator for Ohio Disability and Health Partnership. I'm here at the Nysonger Center. Christine, do you want to introduce yourself?
So is Christine, Kathy, do we have the same issue? Do we have Christine as a, no, she spoke a minute ago.
She's
So
just a presenter. I'm not
Yeah.
sure what's going on.
Okay,
Okay.
sorry, Lauren, back to you.
Can you hear me now?
Yes.
Oh, sorry, I don't know what happened.
That's all right. You're good now.
So, like I said, everyone knows me, but I'm Christine Brown, clinical research assistant and self-advocate faculty at the OSU Nisonger Center. Thanks for letting Lauren Hackenberg and I be here today to share the results and next steps we're saying to take. So why did we do this project? We were wanting to see and learn about the DSP and how it is such critical in the lives of individuals with disabilities. And they're not just only support, but empower in all aspects of living. And like about everyone in this room knows this, but DSP roles face wage challenges and employment shortage. And we are trying to find ways that that we can see how individuals who serve as a DSP, the workforce, and the people they serve, and getting results of neglected DSP direct support worker could include widespread negative economic and social consequences impacting individuals with disabilities and their families, caregivers, DSP provider agencies, and communities. And it's widely overlooked as a public health issue that impacts the health and well-being of thousands of workers with this and people with disabilities. Next slide. So the project purpose was to gain a deeper understanding of the DSP workforce crisis, creating a policy brief to educate ourselves, policymakers, and stakeholders. And we did a survey for this DSP to focus on how to the professional to gain a better understanding of the workforce challenge and opportunities. I will say this to all of you that our coworker, David Ellsworth, who couldn't be here, he was only hoping for 100, but we got like 966 replies. So we're going to be having to go through quantitative data. So this is the areas that we had. We had our LEN trainees that we had 2 of our LEN trainees that worked with us, and they did the draft policy brief of the DSP workforce situation, learning about it. Spoke to the Breaking Silences group. We did work with the leadership of the department, and we had also opera and other entities that worked with us in developing the tool and stuff, and seeking feedback on the survey. And we published in Lucas County met with us. We learned they have an employer resource network, which is where the providers pay into a service, so that if a provider, let's say, had an emergency and they couldn't be getting to the individual's house, these staff that work for the county fill in as alternatives, is what we learned.
Christine, is it okay if I move on to the next slide?
Yes. So the 2020 occupational employment, you will see where home health and personal care aides fall in the salary levels and which careers are pay higher wage and which careers pay less. We learned that. Next. And like the impact of COVID and how we know that did a dreadful impact on everyone, having the way to do hiring and retention. And the survey results, 77% of providers are turning away new referrals. 58% of providers are discontinuing programs or services. 81% of providers are struggling to achieve quality standards. 40% of providers are seeing higher frequencies of reportable incidents. So
these are just, sorry, Christine, go ahead.
Are you going to explain these?
Yeah, we don't have to go through them all right now, but these are just a couple examples of some promising opportunities in other states and some in Ohio as well. If you want to go back and look at these, but we're not going to dive too much into this now so that we can get to our results, our initial results of our survey. Thank you, Christine, for letting us hear all of that information. What she was kind of describing was the results of our policy brief, which is written primarily by our 2 Lens students who were fantastic this year, and essentially covered all of that information, and it's geared towards someone who doesn't know much about DSPs. So not necessarily for this group. However, we will have it available for this and other groups to distribute once it is finished. I believe now we're able to release our executive summary, but until we have our actual policy brief published, we aren't distributing that quite yet. And also, like Christine said, when we first started this project, we expected between 50 and 100 DSPs to respond to our survey. Obviously, we had much more than that. I think in the end, Christine was right. We had around 966 responses, which was just amazing. And since we did have 3 extended response questions, that's just over 2,500 extended response answers that we're in the processes of going through starting this summer. So here are our counties that were represented in the survey. We distributed by reaching out to provider agencies and disability-led organizations. And I think we had heard the most from Summit County, which is my home county. So I was very excited about that.
And any counties that are white means nobody responded from that county. Just to point out to you.
Yes, that is correct. The key is also up there on the side if you're curious about your own counties. So the first question we asked was if they were an independent provider or an agency provider. Most people, as shown here, were agency providers. Most people who took our survey were female. And I'll also take this opportunity to say that because we didn't expect such a high response rate, we didn't distribute this survey in a simple random sample. So these results only, and any conclusions we take from these results only represent the people who took this survey. We are unable to make that statement for all Ohio DSPs. Our age range was a factor that we were surprised by. We had mostly older DSPs. I would have personally expected our response rate to be a little more in the opposite direction personally, just knowing the trends of younger people becoming DSPs. And this was for the people who took our survey. Most of them had been practicing DSP work for between 5 and more than 10 years. So I think that shows the people who took our survey were experienced and maybe had a really accurate representation of what the DSP industry could improve on. For ethnicity, we had mostly white people who were not Hispanic or Latino. And these are some examples of when asked about what their job was before becoming a direct support professional. These were just some of the more popular responses that we received. And then these were the DSPs who served more than one client. It was just over half served more than one client daily. And of the people who took our survey, 63% said that they were unsure about staying in the role over the next 2 years.
What? It said sure.
Oh, sorry. Yeah. Thank you, Christine. Misspoke there. We also asked them to rank these options from a scale of 1 to 5. They couldn't do the same number twice. So this was the loose ranking. We didn't ask on purpose any questions about wages and benefits because we know already that that's a very important issue for DSPs, but they still found a way to let us know that wages and benefits for them is the most important aspect of their job as a DSP, and that came first. For most people, also ranked opportunity to support individuals with disability next, supportive work environment, ongoing training and professional development, and most people, their least priority was opportunities for career advancement. There was a lot of variability in this, except for the wages and benefits. That was the clear lead when it came to the most important aspect for people. As far as incentives and supports, and again, you see we put other than increased compensation, what would allow you to have a long-term career as a DSP? And these were some of our answers. A lot of them still stressed increased compensation. And then also a lot of them I saw requested support from upper management and being able to leave on time from their shift. Those were two, as I was skimming through, very popular responses to this question. We also asked why they do the job, why DSPs stay in their position, and these, if they were planning on staying, why they're staying, and these were some of the answers. And just showing that DSPs really do care about their clients and do want to remain in this work, but understandably is difficult if they're not getting paid a living wage. These results summarize that there are low wages, inadequate benefits, lack of paid time off, and limited career development. That being said, DSPs do care about their clients. I also will say that we are only in the beginning stages of summarizing and doing a whole analysis on these results, just because we did have such a large sample size. So we will be working on this project through the summer, and then it's also going to be our Lend Students project into next fall and through next year. Christine, do you want to do some next steps?
Yeah, so like Lauren said, in our next steps, trying to dig deeper in getting the data analysis to go over these 2,500 responses and finding out what are some themes and the differences between respondents based on age, race, gender, type of employment, and others, and sharing the findings with with workers. So once this really gets all done, it's gonna be able to get published. And we have a goal to have like a some kind of brief for you guys to have prior to the DD kickoff next year, so that with the studies that we get, data is powerful to show why is it important that the DSP is getting a fair living wage, and how many people are leaving this field because of what reasons. Because we're here as a resource for everyone and you guys.
Does anyone have any questions for us or about the survey or the process? I will also say that
Nathan
sorry.
raised.
I can't see the people who are raising their hands, so go ahead.
Oh, I apologize for that. I think my question is, have you been able to dive in the data specifically from respondents that are in a younger age bracket? What their how they would categorize the things that are important to them and what they need from the field, or was that from the data set as a whole?
Sure. No, so that was that for me, that's been one of my favorite parts as we've kind of began to break the ice on looking at the differences between our demographics. I will say that we haven't done a lot on this yet, since we did just finish presenting at the Opera Conference these initial results that we shared with you today. We did that last week. But for younger audiences, we do see that they rank their priorities in a different way that we showed. They have different priorities than some older DSPs. And also we found that amongst younger DSPs, they typically end up having a higher education level. And what we think we can attribute that to, and again, this is just a guess, is that DSP agencies are doing a good job of targeting students in universities. So, but as we learn more about that, we will make sure to let you know. Thanks for your question.
You're welcome. My pleasure. Thank you.
Bethany?
Hi, yes, I just have a simple question. I actually got kicked out during the beginning of the presentation, so I just wanted to see if the slides would be sent out with the notes for this month's meeting. Jackie's shaking her head yes. Thank you.
Any other questions before we end, just in case anyone thought of something that they haven't?
If I could do a follow-up on what Nate asked, I know you haven't had a chance to do the in-depth analysis, but when you said that the younger DSP workers did have a little bit different rank priority, can you give us an insight into what that means at a high level?
So when I'm talking about the priorities, I'm talking about this specific question that we asked. For them, I think it was interesting. A lot of younger DSPs ranked professional development either first or second, which was much different than some of our older DSPs. And younger DSPs very consistently ranked opportunities for career advancement in their lowest category, versus some older DSPs who maybe had been practicing for longer, who had decided to make a career out of DSP work, sometimes had this in the middle, or at least ranked slightly higher. And I think what that shows us is that our younger DSPs kind of see this as more of a stepping stone and less of a full career. However, that's a generalization, and I'm sure there are outliers. And so, yeah, hopefully that answers your question. But yes, we'll let you know the more we find out.
Thank you. You piqued my curiosity there.
Yeah, right? Me too.
I see Pete has his hand up.
Yes, thank you. I thank you for the presentation. It's very interesting, and I appreciate all your work on it. One thing that stuck out to me, and I'm sorry if I missed anything, but when you pointed out that this has become a public health issue, I think is a very interesting take on this. Have you guys developed any thoughts about what the message is around that, or where to take that angle? When I say angle, it sounds kind of nefarious, but I don't mean it to be that way. Have you guys talked about what that means, and in real terms and real stories and real numbers, what the impact is?
Yeah, so Christine, you might be able to speak better on this than me, but my take on that question is that in our policy brief and in our executive summary, I actually don't hate your use of the word angle, because really what we're doing is we are finding ways to present the crisis in this DSP workforce and these issues to lawmakers and to agency providers in a new way. Well, that will hopefully inspire and empower them to increase wages and increase work conditions for DSPs. So I actually don't hate the use of the word angle there, because I think it's all about how you present the information. And I think that's what we're trying to do in our brief and executive summary. Christine, do you have anything else to add?
Not really. I just think that what we're really trying to do is we're trying to figure out how to get everyone's input on how this DSP workforce crisis has. I will say this to you all, that my one company, because to keep myself staffed, I've had to go through 2 companies to split my staffing. And the thing is to make sure all my shifts are covered. And the one thing is that I think that see, in my one company, they are 90% college students. And one thing is they are leaving and going to the job, like they get a job working at Ohio State Medical Center, or if they're planning to go to nursing school or somewhere else. That's another thing. I'll say this to all of you that I'm in the process of, and it's something that we might be doing in Lend, and I might be speaking to John Glenn School College of Public Affairs and College of Social Work. But I'm getting a book that Jed Morrison made of 150 years of the DD of Ohio and the DD system. He's author of that. So it starts like all the way back from the 1800s when Ohio became a state, all the way till the end of 2020, because next year is the 55-year anniversary of county boards of DDs. So we're trying to think of ways to make people aware of how far we came ever since then. But the thing is, trying to teach the new professionals coming into this field about the disability community is really important, because they don't learn about this really. And that's something, because whenever someone is trying to get into a different area, but even focus about this direct support professionals, it's important for me to try to see of us trying to have stories of individuals, what their life has been like, because I always say this, if individuals didn't exist, county boards wouldn't exist, and this job economy wouldn't exist. So we're the asset, so our voice counts.
Thank you. Gary's got his hand up.
It would be interesting to look at where the young educated DSPs are going. My guess, my assumption would be the same thing that happened to many of us that are on this group. We left direct support, but stayed in the field. So career advancement isn't necessarily going from a DSP 1 to a DSP 3. It's going to a service and support administrator. It's going to the director of the ARC. It's staying in the system, even if it's going into the university programs. So I wouldn't assume that just because those young people are leaving being a DSP means they're leaving the field, and our workforce crisis extends to middle management as well. So them leaving DSP may actually be benefiting the system in another way.
Yeah, I can actually speak to that. I was actually looking at our results yesterday, and one thing that we did find was that we're able to filter our results in multiple ways, you know, like the and or. So we looked at DSPs who are on the younger spectrum, are younger, more experienced DSPs. And then we looked at the trends for DSPs who said that they were planning on staying in the field/industry. And we looked at DSPs who didn't. And what we found was actually that it was a pretty close, it was a split. So I think you're right about some of those who are remaining in the DSP field, maybe like our public health students. That's what I was doing when I was in college. And then I think some of the other ones, like this is just a job they've found, and then they move on to their other industry, or they've switched careers because of the pay, as we saw in some of the comments. But yeah, I think that I agree with you that that's an interesting aspect to look at, and I'm excited for us to dive deeper into that. Was there anyone else? Any other questions?
I don't see any other hands up. Anyone else want to jump in? If not, we want to thank you for this information and for all the hard work that is behind you being able to present this information. And we will make sure everyone receives the slides and the executive summary. And in the future, if you want to help push out more information to this group, if you forward it my way or Steve's way, we'll make sure it gets out to everyone.
Thank you, everyone, so much. And I also would like to do a massive credit to Christine. Without her knowledge and contacts and connections, we would never have gotten this project to where it is now. So thank you, Christine, as always.
Thanks. Well, we will, in our upcoming months, be planning to put the year 2 project together. We'll send it to you guys so we can ask for any comment of what's the focus, what are our next round of questions or things, like what steps we're going to take. We'll send the and one other thing that we do is we meet with a lot of the constituents, so like having opera, OSDA, the OACB, and lots of others too. And we have this group that David and I and Lauren meet with. So when we plan to try to do a follow-up meeting to plan for the year 2 DSP Workforce Crisis Project, we'll send out a doodle, and we're gonna figure out a date, and we'll have the meeting on Zoom. So just suspect some invite once we get closer, but we will work during the summer to try to get the quantitative data, but we're going to be having to apply for grants to hire some staff.
Yeah.
So
Thank you, guys.
thanks.
Whoops, sorry, didn't mean to step on you there.
So thanks again for your time and us to present this.
Well, we appreciate you being here. It's good information, and it sounds like your data analysis is even going to make it richer information. So thank you. We also had a pending action item. I think Gary brought this up a meeting ago or so about BCI background checks and the overall background check process, and whether there were any issues within the system that were being resolved or worked on, etc. So Debbie Hoffine was going to give us a bit of an update on that.
I'm sorry, my computer was funky. You want the update on what, hon? See, now I can't hear. You're muted.
I'm sorry, potential issues around how the BCI background checks are going.
Oh, okay. Yeah, sorry. I've been trying to adjust things, but my computer is really in a mood. So I had our provider cert staff do some, gather some information on how the turnaround on the BCI has been and some different things that, we're encountering. The ones that, and I think I've probably said this before, the background checks that don't have any sort of even question to them, and I don't mean like the person themselves is at issue. The BCI runs into a lot of things with common names or that sort of thing, and so if a background check, if everything is unique enough and it goes through very seamlessly for them, the system works very well and very quickly. And we usually see those within 10 days to 2 weeks. But we're finding more and more, there are less and less of those. And so when they have a common name or an overlap or a transposition of a number somewhere, they have to do some manual research to actually make sure that they have the right background for the right person. And so those do take longer, even if they're clean. So, a clean background check, for them to really confirm that they know who they're looking for. Those typically, that can be 3 to 4 weeks before we see those. And a concern right now is, and I think most of you are aware, they did change systems about a year ago. The bugs have been worked out of that. The hiccups have been worked out of that. And so we saw things flowing pretty well for a while, but they've sort of slipped again. And as we started to dig into that, BCI folks, the Attorney General's office has actually got more rigid about their, I don't know if it's a willingness or ability. I really can't, because I don't know how their operation goes, but they're being a lot more rigid about how quickly we can ask for a follow-up. So a lot of times right now, if someone submits a background check, it's been a couple weeks, they hadn't heard anything, we haven't heard anything, we would be able to kind of work through and send an email over to the BCI team to say, can you see if did you get this? Is everything okay? They have recently changed that structure that we have to wait a full 30 days before we can ask for a status on any BCI. So that's going to, that makes our job a little tougher because we can't be as responsive as we would like to be. And it's not just back towards us, it's their policy across, all requests. So that's not ideal. It was not the best news to get that email this week. And so We haven't done anything yet, but we are, and we haven't really fleshed out the details, but I'll be working with the director and our legal folks to escalate that concern, to be able to have a conversation at the leadership level. Hopefully the governor's office will be supportive of us too, to given the workforce crisis situation, to possibly, I always hate to do this, but to give us an exception of some sort, to say, if it's DD, if it's the Department of Developmental Disabilities asking, so another state agency asking a state agency to do something for them, to trust that we have done our homework. We're not gonna, ask for every single one to be expedited or anything like that. But when we're trying to expedite a background check for a family who's actually found someone and that person's ready and willing to work, and then we have to say, well, we didn't get your BCI and we can't ask about it for another 10 days because it's not been 30 yet. We would like to have some sort of special dispensation if we could, that our requests, we've done our homework, we have a valid reason for asking, there's someone in need of services, and it's all hinging on this person's background check being available. Like I said, we've not had those conversations yet. We were contemplating those conversations just as a result of this work group and trying to frame up some meetings with them to see if there was some things we could do to even expedite what we already had, which we thought we had a pretty good interaction with them and we could follow up. Like I said, it was usually a couple of weeks before we would make any noise. And we typically only make noise, like I said, when there's really someone waiting and we really have to have this. But then they issued this 30-day dictative. And so, again, like I said, our next steps are to attempt to have some leadership level conversations to see if we can improve things on that side. We are still continuing to expedite when we get the request to the best of our ability, but like I said, we have to have the background check. So we are keenly aware that anything and everything we can do to work with the AG's office to improve the turnaround on those. I know we've probably talked about it before. If there is any kind of issue with someone's background check, they send us the results via paper mail. So that's also a considerable delay of things, and we're trying to figure out if we can work with them to maybe get that to be in somewhat more of electronic form. Because even if someone has an issue on their background check, it's not necessarily disqualifying offense. It just means we have to review it and figure out where whatever the offense was falls on the scale of what we can do with it and how long ago it was and that sort of thing. So we feel like we have a lot of room for improvement to work with the AG's office around those types of things. The BCI team falls under the AG's office. Sorry, I don't mean to bounce back and forth. So we're going to attempt, like I said, of course, I have to have our legal division support, and it's kind of a legal thing. But we are, again, strategizing internally now how to best approach all of that to see if we can get some traction and have them maybe be a bit more empathetic to our workforce crisis concerns and how closely connected this all is. So that's not the greatest news, I'm sorry, but we're working. We know that it continues to be an issue, and we will continue to work to try to improve on it. Are there any questions?
That helps. Debbie, I know I'm back from that. You personally intervene on our, for many people that are trying to get certified, but I can at least tell all the independents that are contacting me, even though I'm not their rep, that it's not the Department of DD. I mean, from that perspective, it's good.
And once we, I guess I can say too, once we get everything we need, we have sort of at least for the past several weeks, refocused a lot of attention to our own backlog. Of course, the Ohio Department of Medicaid has a major provider project going on right now, the Provider Network Management Module, which is part of the OMS, the Ohio Medicaid Enterprise System. And that was taking a lot of resource time from us to test and work on our interaction with that system, because we interface directly with their provider enrollment system because we're their Medicaid providers. And so a lot of my own staff's resources was somewhat diverted due to some pretty intense testing demands. And fortunately, for a variety of reasons, ODM has moved away from a 7.1 implementation or release of the provider network module. So we have more time in that testing window. And so I was able to redirect all my provider support staff to doing actually no testing for about a month now and focus entirely on our certification duties. And that will continue for the foreseeable future. We will again eventually ramp up with getting the user acceptance testing resumed with ODM, but we don't have to do that at this point. So hopefully also those that are expedited, we expedite, but just in a general turnaround, we're hoping that you're also going to see improvement in that right away as well. So, so I do acknowledge again that we can't control the turnaround on the background checks, but we are trying really hard to turn around our own or control our own turnaround and get that to a better place too. And while still managing our responsibilities to ensure that the Medicaid system has what they need from us. So, but thank you, Gary. Yeah, the background check is causing us a lot of heartburn right now.
Okay, thanks, Deborah. Thanks for checking that out. The last thing we wanted to discuss on our agenda was the go forward mode for this group. We've had a lot of feedback from folks over the last few months throughout the course of this whole first year of work and effort, and also thinking about upcoming processes and how that intersects with the work. And so we would like to make a proposal that we will have our June meeting, but then starting in July with our next fiscal year, we move to a quarterly meeting format. Given that we'll have several of RFPs out there working, people will probably end up on some of those subcommittees, etc. We think that's probably the best use of everyone's time. Of course, knowing that if there is any issue that comes up, we might be convened on an as-needed basis beyond those quarterly meetings. So if we move to that format, we would have our June 8th meeting, and then our next formal meeting would be on October 12th. Then we would have one on January 11th, April 12th, and July 12th. And we'll send all those invites out to everyone as a follow-up. So that is the proposal, to move to quarterly and meetings as needed while the work continues on several other fronts involving most of you. Does anyone have any major questions or concerns? Does that sound comfortable?
Christine, just saying this to all of you. We have usually poster day in April. So as if you all try your best to not have it the same day as the poster day, that would be good, because then Kim and others could come to that poster day. This next time it's going to be in Cincinnati, but something just to point out to you.
All right, well, we can take a look at those dates, and those were proposed.
We'll work around those.
Yeah, we'll make sure we're not, if the ones I just said, if we find out we're smack in the middle of somebody's big conference, we can adjust. But The idea was October, January, April, and then again next July. Renee? I think I see Renee's hands up. You might be on, Renee. There you go.
I got something about that. Will we be contacted if we're going to be on another group? Or how would that work?
I'm sorry, did you ask if we would be? I'm not sure I caught your question, Renee. I apologize.
You said that when we go to quarantine that some of us will be on other groups. I was wondering how we get on those other groups.
How do you get added to the other groups? Is that your question, Renee? Yeah. I think there are other small committees meeting, and I'm not sure who all those are, but I think there'll be other opportunities. For example, Jeremiah led a small group about ensuring that we had the right information about shared living. There was, I don't even remember now some of the other groups. So I think those are things that we could talk about and ensure that if you want to be involved, you can be.
What I would do asking, because like I was involved with the other group because I didn't know about them. If you're not contacted, you won't know, you know.
Okay.
Yes. And I apologize if I made it sound like we would have some formal subcommittees. I wasn't trying to imply that. So we will go forward with that and send you guys, we'll do a cross check on those dates and we'll send everyone formal meeting invites the way we usually have, but we will still be meeting in June. So we do have our next meeting for June 8th from 1 to 2:30. So we are gonna meet next month.
And I guess I would add, if there are things that people want to have small group conversations about, bring those in June and see who else is interested in joining you for those conversations. Again, they won't be formal groups that the department is leading, but we're hopeful that you all will meet, you know, in between the groups and have things to report back on, you know, as we move into the budget season and those sorts of things. So.
Okay. All right, that covers our agenda for today. I do see Nate. I'm sorry, Nate, your hand's up.
Oh, I just wanted to get in quickly. I don't know if there would be, I don't know if we could keep our committee chat open so that if we wanted to easily share information with the group, just some way to keep in contact in between the meetings.
Okay. Probably not a bad idea.
Yes, you can always send things to Jackie or me or Steve, and we will always forward things to the group. If there's a need to have a meeting in between, we can always schedule those. You know, I don't want people to think that we won't stay in touch.
All right.
Does that feel okay, Nate? Okay, good.
Renee, I don't know if you have your hand up to ask another question or if it's still up from last time.
Still up, okay.
Okay. All right, so Kim, that covers our agenda today. Let me hand it back to you for any final comments or thoughts.
All right, well, first let me thank Christine and Lauren for being here and presenting on the survey. I know that you guys worked really, really hard on that. Christina and I talked a lot about her work and, you know, all the time and energy she put into getting DSPs to participate. You know, having that many DSPs participate in a survey is a really big deal. So I'm looking forward to hearing, you know, all about that. So, and thanks to all of you for your participation and today and always, and have a great rest of your week. Take care, everybody.
See you.